Hi, everyone, and welcome to the first installment of the Healthcare Quality Week interview series. My name is Stephanie Mercado, and I am the Executive Director and CEO for the National Association for Healthcare Quality, also known as NAHQ. Joining me here today is Josh Berlin from Rule of Three. He is the CEO there. Welcome, Josh.
Good to be with you, as usual.
Yes, great to have you here. So we are having a three-part series this week where we kind of talk through planning for 2022. NAHQ is an organization that is supporting those who are working in and leading the quality agenda in healthcare organizations. And as a support system for them as they're thinking about 2022 and planning around there, we are kicking off with a broad conversation with you about healthcare trends and what they can expect and plan for in 2022. We'll be moving in our next conversation to April Taylor, who's going to talk about organizational planning and how you kind of pull this through at an organizational level. And later towards the end of the week, we'll be speaking with Emmett Irvin, who's going to be talking about how do you plan for your own success in an organization by really thinking about continued professional development and lifelong learning plans. So we've got a great week shaping up, and I'm glad for you to be here with us today. I would like the audience to first learn a little bit about you. You are uniquely qualified to help us understand where healthcare is going. So if you wouldn't mind, please tell us a little bit about you and Rule of Three.
Sure thing. Always good to be with you, as I said. And if we're uniquely qualified, then certainly NAHQ is more than uniquely qualified to lead a conversation like this. Rule of Three is a healthcare advisory firm. We focus across the full healthcare ecosystem around providers, payers, employers, and advocacy organizations like NAHQ, thinking through what makes healthcare a bit more significant as an industry tomorrow than it is today. A lot of our time is spent in strategy and operations, but even more of that time is spent in the value-based care and population health worlds. So certainly there are not a lack of topics for us to discuss around the direction that healthcare is headed. That's for sure.
No doubt about that. So let's dig in a little bit and talk about value-based care and population health. NAHQ supports the workforce working in quality and safety and really focusing on value. So what are some things that our constituents can expect to see going into 2022?
So as you well know, and certainly so many of the NAHQ constituents are intimately familiar with, quality is an anchor for value-based care and population health. You really can't have success in value-based care and in population health without really a significant quality underpinning. So of course, that means that the stronger your workforce is in quality, both in understanding the way that quality improvement and quality management have worked across healthcare historically, that well positions you to be able to, as an individual contributing to an organization, that well contributes to the direction that an organization is going to head going forward. So the value-based care and population health world, I don't think you have to look that much further than COVID to understand that those organizations, particularly providers who had strength in value-based care and population health excellence, and certainly the workforce to support all of that, were more successful in navigating COVID than those that were not, more successful relative to reimbursement, more successful to understanding the regulatory easing that happened both at the Department of Health and Human Services and through some of the commercial payers across the country. We're more familiar with how to think about coordinating care through an environment where that level of coordination was more needed than ever. And for that matter, the level of digital and technological support that was required to be able to, more than we have in recent memory or maybe ever, be able to interact patient to provider in a much more meaningful, much more progressive way. All of those things attach across a value-based care continuum, I describe it as, where we're really looking to understand how can we increase the level of quality of care that's given at a lower or more affordable price. The workforce's ability to be able to navigate that now going forward, to amplify what we learned during COVID, to amplify what we have learned during such an unbelievably dynamic time in healthcare, even before COVID came along, certainly positions those that are NAHQ's constituents and those that are listening in during Healthcare Quality Week much more significantly for success in the coming months than they ever have been before by just the very design of understanding how to deliver quality with success and doing so as an integral part of the fabric of an organization.
Yeah, I think speaking of the experience with COVID, I mean, you're right. We really did learn a lot. And what's been really interesting to me and sort of talking with quality leaders and CEOs around the country is to hear them ask and sometimes have a hard time answering the question about system sustainability. So we know what worked in COVID. We know the organizations that, weathered that storm and are still weathering it. Unfortunately, COVID's hanging on longer than any of us had hoped or even expected. So we know that some of those organizations did better than others, but there's some questions that are being asked around sustainability and, were we as sustainable as we thought? And one of the things that I've been kind of thinking about is, where we are today, where we've been and where we're going. And as I think about that, I think about some of the data that's coming out with healthcare acquired infections in particular, where we say, we're back 5 years from a data perspective, from an outcomes perspective in terms of how well we're showing up. So the question is where we go from here. And I'm kind of wondering, is 2022 year zero for a nice hard reset because of all the lessons that we experienced from COVID, and we have a more urgency to do healthcare better, faster. I have that sort of year zero in my mind. So with that in mind, talk to me about year zero, talk to me about system sustainability, and how can we leverage those lessons learned to have a great 2022 and beyond?
Look, system sustainability could not be more relevant now than it ever has been before. Certainly, you don't have to look at or throw a pebble very far in the healthcare lake or ocean to recognize that the amount of organizations now dealing with significant staffing shortages that were unanticipated, certainly the quality field being one of those impacted as drastically as those on the care delivery side. The opportunity now to understand how to do more with less than you had to previously. If we were marching towards a value-based care world with CMS's leadership and some of the commercial payers around the country following, we're certainly now under a new administration moving more and more towards a dynamic of how do we do more with less in an environment where so many provider organizations in particular suffered during the course of COVID. And then likewise, you have the amount of private equity and venture capital money that are getting spent outside of the traditional acute care setting, pushing patients into a quality care setting that is ambulatory or clinic oriented. So how does quality look now? What's the quality workforce in a clinic look like versus what the quality workforce looked like anchored by a large hospital or a large health system? As we think about sustainability in healthcare going forward, certainly we're not just talking about the sustainability of an organization, we're talking about the sustainability of an industry that now looks to pivot in a much more significant way on the other side of COVID than perhaps we had even thought possible, where COVID was the kerosene on the fire that the industry really needed to understand how to dynamically think about interacting with you and I as patients or consumers or employees or beneficiaries or members across the continuum of our care in a more progressive, more dynamic way, as I mentioned earlier, than we've ever thought about it before. So sustainability is the right way to think about it. Sustainability as an organization, sustainability as sustainability as an industry, and sustainability and reimbursement models that are going to look very different tomorrow than they have looked today. All of which, by the way, requires a quality workforce to be able to move as the quality ground shifts underneath them a bit.
Yeah, I remember, so I've been with NAHQ for 8 years now almost. And when I first came into the organization, they were really starting the beginnings of the experience of quality sort of being seen as something that would, transcend the entire continuum of care, right? Sort of moving from that, hospital health system where quality has its roots to say, no, quality has to, be across the continuum of care. just in terms of reflecting on that, I think that that across the continuum of care notion just sort of says we have a wide space to cover. But what I hear you talking about is much more integrated within, maybe across, but within the continuum of care, right? That integration, and also a really important focus of putting the patient at the center. So it's not like the patient's kind of bouncing in and out of these different spaces across the continuum of care, but they're at the center, and the continuum has to actually work around them, so that it's much more like an ecosystem than it actually even is a continuum.
Yeah, that's well said. The opportunity for healthcare generally to embrace more than as an industry we ever have before, that the patient, the consumer, the member, the beneficiary, whatever role, employee, whatever role we play in wherever we interact in healthcare is now much more significant than previously. I think even thought possible. COVID was certainly an amplifying factor in that, but I mentioned already the notion of private equity money moving into healthcare and the quality workforce's ability to be able to see the direction that dollars are headed as we move outside of an acute care setting, or said differently, outside of traditional brick and mortar care. And how do we think about the quality of care that's delivered in not just a clinic setting, but more aggressively in the home setting, more aggressively outside of the traditional four walls that healthcare has been delivered. It requires those of us that spend a lot of time in quality and safety to think very differently, almost drastically so, than we have previously thought about or contemplated. And integrated is the right word. You have models of care that are now being proven out across the country around integrated care delivery models, where you have not just the patient at the center, but you have a real primary care engine that's supporting that patient, or an employee if you're working as an employer. You have different folks than you might have traditionally interacted with in your healthcare journey. So now the folks that are embracing quality are social workers and dietitians and advanced practitioners, not all necessarily primary care, even in their orientation, so that you're getting the right care at the right time in the right place. And again, all of that has varying levels of quality. So the more consistently we can focus in on a workforce that understands how to be as dynamic as the industry is around us, certainly the better served we'll be.
Yeah, I totally agree. And I think that the workforce, as far as I can tell, is really starting to internalize what patient-centered care is. Because early on, when we started talking about patient-centered care, that sort of, it had a different meaning, right? And I think we were talking at a very superficial level. Maybe it was about happiness and customer service and getting good HCAHPS and things like that. And now what we're talking about is putting them at the center in a very meaningful way, which, like you said, it's a different way to work. You got to kind of bend the mind a little bit and say, okay, what would it really mean to do this? Because our entire healthcare system has been oriented around the people delivering the care, not those receiving the care. And so we've got to go back in and sort of reverse engineer this, which is definitely a lot of work. I think it's the funnest type of work, right? We call that at NAHQ hard fun. We like to do things that are hard and we call it fun. It actually is for us. So we enjoy that type of work a lot. But yeah, a new day ahead in terms of patient-centered care and what that really means. So appreciating that. Great. Perfect. Well, I am enjoying our conversation here today, and wondering if you have any last thoughts to share with the group here.
You know, I think it would be interesting, if you don't mind indulging me for a second, knowing our time is a bit limited, but as you see NAHQ's role continuing to evolve with the dynamic industry that we're talking about, what does that look like in your mind's eye? How does the NAHQ going forward picture change or amplify based on all the work and stuff that you see around you?
Well, thank you for your interest and for the question. Yeah, I mean, NAHQ is increasingly called into larger and larger venues to provide a voice for quality and safety, and to ask and begin to help answer the question, what would it take for us to really have quality and safety underpin the whole value equation? What I think about for us, in the near term, one of the things, and really it'll probably take a while because I don't think this message has been heard yet, though we've been trying quite mightily for a while to get people to really understand that it's going to be really difficult to change healthcare delivery and to get better outcomes if we don't fundamentally change the healthcare quality competencies that those are built on. And to really understand sort of this lock and key combination that are required for the clinical quality competencies and the non-clinical quality competencies, which is where NAHQ's constituents really live, right? Is in the back of the house of healthcare, really advancing the quality, safety, and value agendas. So, for us, it's really about that, and sort of saying, let's take a look at that. Let's move upstream and solve this challenge. Not only that, but I think that, our work increasingly, I mentioned this with some frequency, so people may have heard me say this before. But, when we think about the work that NAHQ's done, we've been focused on supporting individual contributors because we're a membership and certification organization. And that is our foundation, it is our core, and we will always be supportive to that group. But we also need to really be thinking about healthcare organizations, the health systems, and all the contributors across the continuum of care. We really, really need to be working together with those organizations, because for us, we know it's really difficult to affect healthcare quality, one quality professional at a time. So we're really working on scale to partner with health systems and beginning to get a bird's eye view into what their workforce is even doing relative to quality and safety. Because in fact, our data and our experiences tell us that healthcare quality systems, process, structure have been developed on the fly at a local level without the benefit of a standard. So we see, as part of our go forward, is to put some shape around that, not only in supporting individuals with continued professional development, lifelong learning, but to support organizations, systems, process, structure, job descriptions, competencies, and put the whole thing together so that we can really benefit from a less variable workforce. We try all the time in healthcare to root out variability, and I think we need to start looking at our own selves and see what we can do from a workforce perspective to do that as well. So, that's sort of high level where I think that you'll see us. We are really excited about the work that we're doing, and I would say minimally, NAHQ will be participating in all those things. And, you never know where our journey will take us, but always for us pursuant to quality and safety, workforce development, and especially supporting this profession, which is evolving and incredibly dynamic and making a huge, huge difference in healthcare.
That's exciting stuff. I appreciate you indulging the question, and looking forward to continuing to watch and admire as that mission and vision continue to unfold. It strikes me that the opportunity to embrace the old Abraham Lincoln quote, I may walk slowly, but I never walk backward, is more applicable now than it ever has been before. If we just continue to move deliberately and intentionally forward, then we'll certainly make the right decisions for the hoped for future we're all looking to achieve.
Definitely. Well, thanks for your time today, Josh. I really appreciate it. I had a great time chatting with you today, and I hope to speak with you again very soon. Have a great week, and happy Healthcare Quality Week, everybody. We'll see you several times throughout the rest of this week. Enjoy and celebrate all of your success. See you later.
Thanks.